Dr. Moshe, how are you doing today?
I'm doing great, thanks. How about you, Dr. Ben?
I'm great. I'm so glad you're joining us today. Thank you so much. So
It's
I'm Dr. Ben Reebs, an associate of the Naturopathic Medicine Institute, or NMI, working toward my Vitalist Fellow Track certification. The NMI envisions a world where enjoying optimal healthcare allows people to reach their highest potential for inspired creativity. It asserts that the highest ideal in healthcare must act in concert with the healing power of nature. And today we have NMI associate Dr. Moshe Daniel Block joining us to talk about holistic counseling, the Vis Dialogue, and the power of vitalism. But before we get to our discussion, Dr. Moshe, would you please tell us about yourself?
sure. I graduated from the Canadian College of Naturopathic Medicine in the year 2000, and just when I started the program, I was quite sick. Actually, just before I started the program, in 1995, I was diagnosed with a rare autoimmune disease, myasthenia gravis, and I had an amazing dialogue with someone who had been trained in something called the Optiva dialogue. And by a series of simple questions, they asked me and they revealed this sort of underlying belief system about what I was struggling with. And I got to this place where the question was asked to me, what makes you think you need to be perfect? And then I had a recognition that I didn't. And in that moment, when I released that belief that I had never been even challenged or I never recognized what it was about, I didn't even realize I had that belief, I had a spontaneous healing. And I realized in that moment, Dr. Ben, that the body is a reflection of the mind. That my body was reflecting what I had been doing, because believing I needed to be perfect, I judged myself harshly for not being perfect, because it's impossible to be perfect. So, and when I judged myself harshly, I attacked myself emotionally and mentally, emotionally, and then my body said, all right, we're in the business of attacking self over here, and the autoimmune condition was a result of that. So that was a very priceless lesson that I had, and my health, yeah, really healed tremendously in that moment. And I had a hard time in the 4 years of naturopathic medicine. I quit 3 times,
Oh, really?
but came back. I'm really glad I finished because I'm really proud to be a part of this profession. I love it, but I really struggled with the education. And I really feel like it's even worsened and distanced itself even further from the vitalistic and holistic philosophy that it hails from.
Right.
So I wrote my first book in 2004, The Revolution of Naturopathic Medicine, which deals with the practice and the philosophy of naturopathy, and is also a critique of the direction that the profession was going in particular at the college level.
I got you.
And
Yeah.
yeah, and then so I've practiced over the last 17 years, and I've developed this process called holistic counseling, which I'm now teaching, and I have a course which I teach naturopathic doctors and students and other healthcare practitioners. And I just recently, last year, published the book, Holistic Counseling. So that's a kind of a brief overview of what's going on with me.
Thank you so much for that. I just want to jump in and kind of dovetail or with what you had said. In vitalism, we talk about how healing proceeds from the top down, from the mind and the spirit down through the body. And so, gosh, your story is such a powerful example of that. That
Yes.
direction of
And
healing.
yes, and you know what it has helped me with is having clarity and being able to dispel the doubt that surrounds holism and vitalism. Because, the established process of medicine, which is heavily, evidence-based and a lot of scientific evidence, and, it's easy to be confident when you could pick up a paper and point to it on a paper and say, well, this is what's going on. But the subtle processes of holism and vitalism are subtler. And in our society, it's really good to have something very clear that we can trust. When normally it's hard to trust these aspects that are of the subtle vital force nature. So that's what that gave me. I became very clear, and I was able to, even during times of darkness, so to speak, which we all go through, I was able to rely on this experience to remember the connection between the mind and the body. Because it's easy, especially when we're starting out as doctors, you know, it's hard being a practitioner starting out. You know, we have to build confidence in the business aspect and getting patients and all this stuff. It's hard. So it's easy to default to a medicine which is quote unquote proven and accepted versus a more vitalistic form of holism, which is the road less taken. So one of the things that's most important as a practitioner that I've learned is to trust the process, because patients are going to be going up and down a little bit, and when they hit the down, they want to like beeline to the doctor and get a drug or get some kind of a allopathic measure to alleviate the suffering, which is fine in some cases. But in others, it's a diversion from the path of healing, which requires a person to have a little bit of that suffering. So through that, they are seeking deeper answers for themselves.
Mm-hmm.
And I found those deeper answers to lie on the mental emotional plane, as you mentioned before. Yeah.
So do you think that there's a way for these two paradigms, as Dr. Sensenig calls them, to operate, or is it that one needs to choose, choose the road less traveled by or the road more traveled by?
Yeah, very good question. So I believe that there will always be a place for allopathic medicine, and that's for those who are not aware of what that means. I'm sure most people do, but it's basically a this for that medicine. You know, you have this prescription, this is good for this disease or this symptom, so you give this external prescription, whether it be supplements or drugs or herbs. It's just some kind of formulaic answer. I think there will always be a place for that, especially in acute illness, where a person's life may be threatened. So there's always a room for that. Now, having said that, in chronic illness, the holistic vitalistic approach is the most honest and in harmony with what's really happening in the human being to bring about a real lasting cure. And the other paradigm, the paradigm of treating symptoms, is simply misaligned with where a patient really needs to be brought in order to heal. So it's a misalignment, and the two absolutely clash in the sense that the allopathic and conventional approach interferes with the process of healing. It simply interferes. So in that regard, for the chronic illness where a patient has time to heal, you know, it's not dangerous for them, then the holistic, vitalistic approach is by far the more intelligent and the more effective one. Definitely.
That's so great. It's so fascinating how the word heal is rooted in the word wholeness. And we even get the word salvation from the word to heal. And, you know, we have the word salve, like a balm, healing balm. Yeah. And then the word allopathy, which was coined by Hahnemann in the 1860s or 70s, means to replace with the other disease. Allos, I believe in Greek, means the other disease. Or, right. You know, and it's just fascinating how these two paradigms clash, as you mentioned.
Yeah, exactly. You know, I'm a big fan of homeopathy. I love homeopathy. I also practice since day one. Actually, my first moment in class in first year when I heard homeopathic theory, it blew my mind. I didn't even know that such a thing existed until I started studying naturopathic medicine. And you know, it grieves my heart that this is being phased out of the programs. Because I just recently wrote an article titled, it's a letter to the editor in the NDNR. It's about a criticism and a look at what's happening at the profession at the school level now, that there's phasing out of vitalism, being replaced for evidence-based, which is a tricky and sort of a misleading term, because it makes you think that if evidence-based is not practiced in that specific minute way of doing it, that there's no evidence to what we do in vitalism and holism, when there's so much evidence. There's without a doubt, there's so much evidence. So yeah, so I love homeopathy as well, and it's a very also holistic, because when you give a remedy, if provided you're not practicing, acutely or just giving symptomatic relief, you're looking at the whole picture. You have to look at Hahnemann stressed the importance of the mental symptoms, but of course it's not only the mental symptoms, but it's part of this holistic picture. So homeopathy is one of those medicines which is very holistic and very effective. It's also a very challenging medicine to practice efficiently, and requires a tremendous amount of study and discipline, and there's a great learning curve there. So it's an example of the kind of rigor and intense education that we need, that I encourage, that I support. A lot of our culture is sort of getting absorbed in the quick fix of the response of the smartphone kind of culture. Whereas there are the naturopaths of the future, we still have to be very dedicated to intense study, in order to become efficient healers.
I love how your book is called The Revolution of Naturopathic Medicine. I really believe this medicine is the future of medicine, and even if it's not practiced by the many, and even if cycles repeat themselves, and things are always the same and history repeats itself, I still believe this is the future of medicine. I'm curious about, well, I've got a couple of questions. I'd love to know how you practice homeopathy. I'd also love to know what questions you ask in this Vis Dialogue, like what line of questioning. So I know those are two completely different questions.
Well, they're not entirely different, you see, because I use the questions in the Vis Dialogue to go into what I call vertical descent into the subconscious mind of a person. So the questions are geared, part of the Vis Dialogue, and Vis comes from our beloved tenet of naturopathy, Vis Medicatrix Naturae, the healing power of nature. So it's the healing power of nature dialogue. And it's a series of questions that are based in a very simple principle of the fact that the truth lives inside of the patient. So that the doctor's role is to reveal to the patient, so that they have revelation and something they could take home with. We're teaching them to be a fisherman, woman, rather than giving them a fish. So the knowledge that we have is how to do that. It's not to impart to them and say, here's the knowledge, this is what you need to know. It's to help ask them questions so that they look at themselves and the truth is revealed from within them, which has a lasting impact, and also through my cases, spontaneous recoveries to their symptoms and their pathology. So I use those questions also. The information that I get from the patient, I also use that and I plug it into the homeopathic case taking as well. So the two very much work together beautifully. Yeah. So non-directional, non-judgmental, patient-guided questions. How do you feel about that? Oh, I feel very frustrated. Okay, tell me about being frustrated. Well, it's like nobody's listening. Well, how do you feel when nobody's listening? Well, I feel like I'm not important. What's that like for you, not being important? Well, it feels small. I feel diminished. Tell me more. So it follows the principle of following the stream. A person says something and then you ask a question based on what they just said. And this is the basis of my book, the basis of my course, Holistic Counseling, and which is also, so on the one hand, holistic counseling involves the process of the Vis Dialogue, and on the other hand, I teach how to practice holism, mind-body holism, which is not readily taught at the colleges, and it's almost like I think it's an ancient form of medicine, but it's also budding in this day and age, mind-body. So we find a way to establish in the mind, to recognize how it started by going through the physical pathology. So I teach techniques of how to start with the physical symptoms and then to slowly reveal and demonstrate to the person so that they could see the connection between the choices they're making and what they believe and the physical symptoms that they have. And then they have this aha moment, which is a great gift that we can offer.
Wow, that is such powerful work you're doing. I'm so glad you're offering this up. How long do you like to spend with a patient at first? Is it a couple hours or?
Yeah, it's between an hour and a half to 2 hours. I like to keep it towards an hour and a half. So I like those efficient cases where the things line up and go well. Sometimes it's a struggle and there's a lot of dense energy to get through, so it'll take more like 2 hours. But I know for myself, I'm really crisp and I'm really sharp for a good hour and a half. And then my energy, because I'm focusing so intently with that person, it'll start to diminish a little bit. So I know that I'd like to try to keep to around an hour and a half. Yeah.
And do you find that this only works in person, or do you actually like to do it, over Skype or virtual, just like we're doing right now?
Yeah, well, great question. I do most of my work through Skype, and that's not because it's better, but because it just kind of happened that way. I'm a specialist in the rare autoimmune condition that I've faced, so I specialize, and people reach out for my help across the world, and it's not always feasible that they're going to get on a plane or drive. A, they're sick, and B, it's expensive, and it takes a lot of time and money, and so it works. It provides a modern day solution to help people be able to work with me where they probably couldn't otherwise. But I like it in person better, You get more information, you get the vital field is much more tangible. As a homeopathic observer, you didn't necessarily know that the person was tapping their leg, like restless leg syndrome, or you miss some information through Skype. However, I've been able to help people a lot still through that process.
Well, that's awesome, Dr. Moshe. Is there, or where can people go, to find you? What's your website?
The best website to find me, you could also contact me through there, would be holistic - like a minus sign, counseling with 1L.ca. And there I also, under the events, you could see some of the future events that are coming up. One of them will have a webinar in Connecticut, October 13th to the 15th. I'm teaching part 1. And very exciting, I'm teaching part 1 and part 2 in Costa Rica in January. So if people want to, have a retreat from the winter and get away and really unplug and learn this mind-body medicine, it's a great opportunity for that.
Wow. Well, we're just about running out of time here. Thank you so much for taking the time today out of your busy schedule. Is there anything else you want to mention, or any other tidbit you want to offer up to folks before we check out?
Yeah, sure. I like to offer up this point. Physician/healer, heal thyself. I really emphasize this in the class, that those physicians who are not working on themselves, and it doesn't mean you have to be perfect, but you're looking at your issues, your insecurities, your fears, your woundedness. You become so much more effective as a practitioner because you understand you've walked this path and you could handle the intense movement of energies that occur with the patient. And if you're shut down and afraid of grief, afraid of your anger, or whatever stuff you're dealing with, and that shut downness, really, the patient really senses that and will not feel comfortable to be open and to go deep into the places they need to really heal. So heal thyself, physician, heal thyself is one of the most important principles, I feel, as a vitalist naturopath.
Well, I can tell that, we could just talk forever about this stuff, Dr. Moshe, and I look forward to hearing you on the Vital Conversation and getting your book, and I'll definitely link to all your stuff here at the bottom of the broadcast.
Thank you.
If you want to learn more about how to become an associate of the Naturopathic Medicine Institute, head on over to naturopathicmedicineinstitute.org and watch for our upcoming conferences and events. We have the Vital Gathering 2 coming up October 13th, 14th, and 15th in Phoenix, Arizona. At the Naturopathic Medicine Institute, laws of cure are seen to be immutable, and the healing power of nature is acknowledged, discussed, unpacked, and celebrated. Thanks again, Dr. Moshe.
You're so welcome. Thank you too, Dr. Ben. It's been an honor and a privilege to be a part of this.
Thank you.